I would like to thank Mr. Madan and Emerging Tech for this opportunity. It's my pleasure to speak with professional community from India, which is also my home. Today I will be speaking on available IoT applications and possible scaling up strategy from COVID-19 pandemic perspective. My name is Anup Kale. I'm a data scientist for Cloud Tech Info. We also have a research startup company called MAppsAI, of which I'm also a co-founder. So today's agenda includes discussing background of this crisis and how IoT sensing applications can possibly transform three of the main key pandemic areas or pillars on which IoT strategy is resting on. Later, we will start discussing a couple of levels deeper in each and every pillar to see how IoT use cases can help to address each and every dimension and transform them. Then we will discuss proposed strategy using process for transformation and system remodeling approach. Finally, we will discuss about cloud tech info activities and main takeaways from this presentation. So looking at pandemic history from year 2002 to today's day, we can see quite a few periods of time when we had quite a few people being affected by some or another pandemic crisis. At the moment, we are talking about COVID-19. As of today, it is more than 100,000 people died with this particular disease. So 7 numbers supporting IoT for enhancing healthcare systems include 95% of non-critical cases. So what it means is 95% of cases, we have large scope to ask them to either get treatment from home, and we can try to set up remote monitoring systems for them. So globally, the healthcare expense starts from $41 per person and it goes up to more than $40,000 per person. Globally, we are talking about 0.1 to 13.2 beds per 1,000 population. And in the world, we have 1 to 82 physicians per 1,000 population. 10% of global GDP is being spent on healthcare. $62 billion worth market belongs to IoT technologies. And by 2025, we are looking for at least 21 billion IoT devices being ported and implemented, which will be in use. Typical monitoring scheme involves a monitoring environment, which can be a person located remotely either at home or in some facility. That person will be wearing a wearable device, which will be monitoring vital parameters, and he may also be using mobile phone either to communicate with the remote healthcare staff or even having these devices being connected to that particular handheld device. Then there is a wireless communication which will keep on transmitting those vital signs to application servers which may be located on a cloud, and from there the clinical staff will be able to refer to any of the vital signs which may be out of the range or out of the spectrum, and that particular person may need help from them. So how IoT can assist in pandemic control? Looking at this particular picture, what I am seeing is IoT strategy can rest on 3 pillars. This is specifically for this particular crisis, and it's been drawn by me, by the way. So one of the pillars can be transforming healthcare system, another can be improving personal hygiene, and third is managing social factors. Underlying those pillars, there is a big layer of IoT technologies, and there is also policy. Potential pandemic dimensions to transform based on those 3 pillars can be enhancing isolation, reducing staffing burden, managing demand of the patients, and reducing response time, and also optimization of healthcare assets. So looking at the first dimension, which is isolation of people or finding out isolation candidates. Isolation depends on what sort of venue you're looking at, what sort of number of people are visiting, in what frequency, and what type of interaction they are having. Are they sitting close to each other? Are they having direct physical interaction? And finally, it is about vital parameters of individual who are part of that particular group or crowd. So FluSense is one of the research offered by UMass, which is University of Massachusetts. So a couple of researchers came up with a wall hanging device called FluSense. What it does is it uses thermal camera and audio sensor to detect potential candidates in an enclosed environment. So using those two types of sensors, it detects size of the crowd, it detects if someone is sneezing, and it also detects if someone may have potentially flu. So this particular concept has been trialed for 8 months in 4 of their university clinics, and it seems to be it is working well, and it's making some rounds of global news. So researchers are looking to use this particular prototype and create some level of isolation strategy out of it. Reducing staffing and infrastructure burden. Now, when it comes to reducing staffing and infrastructure burden, you need to have a look at what level of routine diagnostics and infection control happens through staff. Then you need to have a look at patient and asset tracking. Apart from that, patient environmental monitoring, patient may need, fans to be switched on, lights to be switched on, and for that they may be using staff. And finally, it is about quality of service. At the end of the day, patient is at the center, and quality of service cannot be compromised. Biosensor Patch is one of the products tried and tested in United States. What it has is a sensor patch which can be glued on the body of a patient. It does monitor vital signs like ECG, breathing pattern, body temperature, and SpO2. It is highly scalable, and at the moment it's been mass manufactured from COVID-19 response perspective. It does trigger alerts for intervention to improve response time. Last year it was tried on 20,000 patients, and it looks to be a very reliable product. This particular sensor patch can be glued on a body for 5 days. It's a one-time use, and what happens in the process is nursing staff or clinical people don't have to interact directly with the patient, and they can use this remote monitoring sensor, and that's how the interaction level reduces, and in a way staffing burden as well reduces, and potential of staff catching up in this particular disease as well reduces. So it allows you to monitor patients in the hospital remotely, or you can also send some of the patients at home and start monitoring them remotely. Next is about predicting demand during pandemic crisis. Demand prediction will be directly proportional to demographics, population density, then prediction of spread, finding sensitive clusters, and calculating support. Kinsa is again a company from United States. They are mainly into thermometers, which are IoT thermometers, means they will sense the temperature of body, and at the same time through wireless connectivity, that temperature reading will be collected on the cloud application server, and then later on those readings will be plugged into this heat map graph, where you will be able to calculate density of patients in a particular area. Based on that, spread prediction can be calculated, and it's a real-time monitoring, real-time recording system. At the moment, Kinsa has sold more than 1 million devices, which means they have covered at least 2.5 million people. And daily basis, they are selling 10,000 units. So it seems to be a very interesting and promising solution to predict the spread. Managing response. Now, when it comes to finding response ahead of the time or in real time, four main parameters underlying that you need to have. I'm sorry, the response actually has got four stages. One is standby stage, second one is initial stage, then targeted action, and finally it is about stage down action. At the moment, we are in targeted action phase. Now, when it comes to standby, when it comes to predicting response, there is a product called CCN Plus. This is nothing but hand wearable device in which a wristband will monitor your vital parameters in real-time mode. Those parameters will be sent to clinical staff, and they will be able to find out any susceptible person, and based on that, they will be able to give them some sort of message in advance, and a person who is wearing this wearable wristband also has a mobile phone on which clinical staff will be able to send a message and then isolate them by giving a response well in advance. Next is about location tracking of people and assets. Centrac is a company who is involved in IoT sensors for tagging people and assets. Now, when it comes to assets in this particular scenario, ventilators and beds are very crucial in hospital. Having any unutilized or partially utilized asset would mean that people who are in real need of those assets won't get them in time. So now using this tagging sensors like Centrac, what you can do is you can track those assets and manage them effectively to optimize your resources. At the same time, when it comes to patient tracking, this particular technology is equivalent to Google Map in enclosed environment, where every person's path of walk and wherever they are traveling around can be tracked, and based on that, their personal hygiene and their physical connection with any other person can be tracked. And that's how basically you can predict potential hygiene related issues, and you can also optimize the capacity. So summing up everything together, what we need is to use all those technologies together to create a strategy for IoT devices. So I propose to have two different perspectives to this particular strategy. One can be process transformation using a cyclic process of monitor, predict, isolate, respond, and optimize. And second is about system remodeling, because currently whatever systems we have, those needs to be transformed into a new, much more agile systems to respond to this crisis. So system remodeling requires intersection of policy, clinical expertise, and sensing technology. At the end of the day, policy and sensing technology should be supporting the clinical expertise to serve people better. But that sort of remodeling, especially at systemic level, can be done by using enterprise architectural modeling tools like Archimate. So looking holistically at scaling up strategy, we need to think about enterprise-wide modeling, then human-centric systems. So we need to have systems which will be useful for nursing and clinical staff, and also useful for patients who are using them. Then we also need to address cyber security concerns, because when we are in a hurry, there is a good chance that we may miss out on security part, and then we will be giving an open invitation to those hackers to breach into and steal the data and do whatever they usually do. And finally, it is all about leveraging the cloud computing technology, especially in IoT context. There's technology called as edge computing. So yeah, holistically speaking, we are looking for those four aspects. So cloud tech info approach towards such kind of problems involves um, assess the drivers of transformation, then determine the expectations of customer. Based on that, come up with comprehensive maturity assessment. After that, think about modeling their current capability and give them roadmap. Then identify a methodology specific to this particular type of project. Then define skills, tech and technology stack. And finally, assist them for product selection, and then they can select product and they can start their transformation journey. Our services are smart, means systematic, measurable, affordable, reliable, and a tailored approach to achieve customers' business goals. And about MAppsAI. So MAppsAI is a research arm of Cloud Tech Info. At the moment, we are involved in research and development of two products. One is IoT platform with artificial intelligence for monitoring disaster events. And second one is technological capability monitoring through NLP and document analysis. So this is the time to give it back to society. So what Cloud Tech Info is doing for this particular coronavirus crisis is we are trying to create technological awareness through writing articles and giving talks. At the same time, soon we are coming up with free online training for health and university professionals who wants to use photograph and Archimate for their digital transformation projects. So these are two links. Just keep an eye, and if you belong to one of those two professional categories, please write us and please join the course. Finally, the major takeaways out of this presentation are IoT can be a cost-effective and real-time monitoring solution for this particular crisis. It will definitely help reducing staffing burden so that, those staff can serve more and more patients, and the overall capacity will be increased. It's possible to predict the spread, as we have seen through Kinsa, like simple thermometer technologies. IoT will definitely help isolating infected patients, but the success will depend on selecting correct technology, policy, and procedures. Thank you very much for listening. If you have any questions, please ask, or else if you have any questions, please write us at info@cloudtechinfo.com. Thank you. Right, so I'm seeing few questions being typed here. So first question is how people can approach IoT journey at the beginning of their career or project cycle. So my suggestion here is, first of all, look for a particular problem which really concerns you, and try to use ready-to-use IoT packages, which will include IoT platform like Microsoft Azure or any other equivalent. I think there is ThingsWorks as well. Try to use sensors which will be directly applicable to your application, and then create an application so that you will not be wasting a lot of your time in developing components, but you will be directly into application development, and you will be directly start getting value out of it. Okay, thank you. Next question is, do we need to convert analog signals to digital before we start using them in software? Now the IoT has moved to the phase where you can buy sensors directly applicable to your particular application. What it means is you're looking for a package of sensor rather than building them. So the real money is not about developing sensors or not in hardware. The real money comes from developing application around it and creating value out of it. So my suggestion is don't worry about this analog to digital or any electronic engineering activity at the moment. Just think about buying a sensor as a package and plugging that into your software application. Next question is there any example of the combined approach of IoT and natural language processing? One example on the top of my head I can think of is you have an IoT application which is monitoring vital signs. At the same time, there may be a communication happening between a patient and clinical staff using handheld device or mobile phone application. And whatever data is being transferred between handheld device and clinical staff, that will be obviously a natural language. So you can combine IoT signal and natural language in a way that IoT signals will monitor vital signs and NLP will give certain answers to questions being raised. So IoT signal can validate any of the answers given by patients. Next question is, what are the main aspects beginner to focus on health monitoring systems using IoT? I think I answered this one in a way in my first answer itself. So at the beginning, start looking for any of the components and subsystems involved. Don't try to develop everything from scratch. Just try to integrate everything together and try to create value out of it. And then if you are thinking that a particular component, especially hardware, is not fully compatible or it's too expensive, then you can always think about developing that hardware locally. And the last question is, do you see people using IoT sensors practically for COVID-19 crisis? Yes, I mean, all my examples are about working solutions. So yes, people are using IoT sensors in COVID-19 crisis, and they are definitely adding value. They're definitely adding to the bandwidth of current healthcare facilities. So yes, COVID-19 crisis has got IoT as a helper. Right. Thank you very much. Thank you for listening. For anything, please email me on info@cloudtechinfo.com. Thank you.